UnityPoint Health Trinity is hosting an in-person job fair in Rock Island later this week. This comes as healthcare providers across the country and right here in the Quad Cities have seen labor shortages, the same ones seen in various sectors across the American labor market. Joining us now to talk about what that need looks like and the opportunities that are available, Sammy Widener, Regional Talent Acquisition Manager for UnityPoint Health Trinity. Sammy, thank you so much for joining us this morning.
Thanks for having me.
We want to start by talking about really kind of what the last 2.5 years has looked like for your organization. The need for healthcare workers, of course, immense during the height of the pandemic, and now you're in a position of needing workers. What's driving that shortage?
Yeah, I mean, we've definitely felt a shortage here with the pandemic, along with the unemployment rates being really low, and just the sheer options that not only non-clinical applicants have, but clinical professionals as well. They have options to travel, they have options to work from home. We also are still very much seeing the baby boomer generation aging out of the profession, and that is also coupled with some of the like clinical programs really having lower enrollments than they have in years past. So all of that has really added to our current state of things.
Yeah, it seems like it's all coming to a head all at one time. For your team specifically, where is the greatest need?
So we have needs really in all areas. We have 4 hospitals in this region. So the 2 in Illinois, Moline, Rock Island, our Bettendorf campus on the Iowa side, and our Muscatine Rural Hospital. Plus we have home care here that covers about a 50-mile radius in the Quad Cities, same with Muscatine. And then we have over 30 clinics. So, you know, we really have about 400 clinical openings in those 6 spaces that we're looking to fill.
When you say 400, that sounds like a lot, but can you put that in context? Is that a lot more than usual, or is there a sort of a typical number of sort of constant need that you have?
No, I mean, I would say we definitely are feeling that our numbers are up more than they have been certainly before the pandemic. You know, probably 1.5 or even 2 times more than what the need was before. And again, just some of those things I mentioned, we're seeing lots of the clinical team members are just really leaving us to go travel, or they're leaving us to do a work from home clinical role, or they're just leaving the profession altogether. The pandemic was hard on everybody, but you know, it was most hard on our clinical team members, those frontline workers.
How have you adjusted your recruiting strategy to compensate?
So we started doing a lot of virtual hiring fairs. That was really to you know, provide a safer, more comfortable way to connect with the end users or those applicants, and also for our leaders as well. So we had to get a little bit more creative. People definitely like everything at their fingertips, no matter what it is, ordering food or applying for a job and interviewing for a job. So we kind of have told people, we'll meet you where you are. We'll interview you virtually, whether you're at home, whether in your car on your lunch break from another job or something like that. So we've tried that, and that has been really successful for us. But we're kind of, you know, back to in person and hoping to interview people and really connect with them one-on-one, since it's been, you know, at least, you know, 3 years since we've done that with the pandemic.
So let's turn to the job fair later this week. What do people need to know?
So it's a clinical career fair. So the open positions that we are interviewing for is RN, LPN, certified medical assistants, CNAs, patient care techs, paramedics, ultrasound and radiology, surgical techs, all of those roles. They just need to come prepared to interview with a department manager, bring a resume, and we'll talk about their work history, their experience, and their goals.
All right, lots of good information. Sammy, good luck to you later this week.
Thanks so much.
And our thanks to Sammy Widener, with UnityPoint Health Trinity. Here are those details again. That in-person hiring event is